contact between nerve and vessel. Is 3.7 millimeter from the front. And it is transition zone. In the left is normal.
So the bright one is blood vessel, right? The black one is the black one is cranial nerve 7, right? Hello, can you show me more clearly? Because to be honest, we are just a newbie in this topic. Where is the cranial nerve and where is the blood vessel? Can you point the arrow in this? Can you point the arrow in them? Okay, what is it? What is it?
Yeah, you should turn off the mic from ra ban hội trường and you use the audio from your own laptop or your phone. You turn off the audio of ra ban hội trường and you turn on your audio. You use the audio from your phone or from your laptop. Yeah. Okay, so let's try.
Right lateral is right vertebral artery, and it is on this edge and segment edge of nerve.
Okay, this one run into internal mediated, right? Internal auditory mediated, right? Lỗ ống tai trong. So this is going up 7 and 8, right? And it is stretching by vertebral artery, which causes a symptom of facial pain on the symptom, on the clinical symptom, right? Okay, clear.
Okay, so can you go down? Go down. Is going up. Yeah, it's going down. Okay, so today we can see that the left and the right vertebral arteries is come from from the right, the same side, right?
Same side. Okay, deviation.
And the right one, the right vertebral arteries is compressed. The facial nerve. The ipsilateral. Okay, it's quite.
Okay, it's clear.
In this way, it's the stretching of cranial nerve.
Okay, stretching.
Maybe we can see the we see the the grooving as well, the grooving, the bending, and stretching in this case, both all three abnormality, right?
Yes.
This case is quite clear. Okay, so what's the second case, please?
this patient with trigeminal neuralgia. On that. You can see the trigeminal nerve is in charge between two vessels.
Sandwich.
Configuration or compression in this case is sandwich compression.
Yeah, sandwich pattern, right? Okay, so what are the vessel? What are the
One vessel and one vessel is AICA.
Icon.
Okay, so which one is AICI?
AICA.
And which
two is two vessel. I don't really this is horizon.
can you zoom in on corner plane, please? Corner planes. Can you zoom in, please? Okay, and make it darker. Make it darker. Okay, and can you show us the conflict location, the conflict area by the arrow? By the arrow, you use the arrow and you show us the conflict area. On
this one is identify root and join.
One is
3.3 millimeter.
Okay.
So
identify root and join.
a value for the trigeminal nerve. What is the kind of value for the trigeminal nerve for the REZ region?
Root up and join.
And trizone.
I don't need to be in this vessel. Is
So what kind of abnormality here? Is this, you know, bending, grooving, or stretching?
Grooving.
Grooving. Can you use the arrow? The arrow. Show us. Please use the arrow. The arrow. Yeah, this one. Use arrow. Okay, so this one maybe. And how about on the coronal plane? What is this? What is this structure? Is nerve or artery?
It is a nerve between two vessels.
Okay, this is nerve. And where are the vessel? Where are the vessel?
This is AICA. And it is, I don't know.
Maybe SCA. You know that the SCA is the most common cause of neurovascular conflict. The SCA.
Yes.
Okay, so and can you tell me what is the the you know the cutoff value for the root entry nerve of trigeminal nerve and facial nerve. Yeah. What is the normal, you know, the normal
is around 4 millimeter. Around
4 millimeter for which nerve?
4 cộng trừ 0,81 ạ. 4 cộng trừ 0,81.
Yeah. For which nerve? For the fifth or for the seventh?
For trigeminal nerve.
Okay, for the trigeminal nerve, the root entry zone is 4 millimeter, right? Around 40 millimeter, right?
Yes.
And how about the facial nerve?
Facial nerve is 2.8 cộng trừ 1,9. 2,8 cộng trừ 1,9.
Okay, so it's near is 3 to 4 or 3 to 5 millimeter, right? Okay. And Nga, how about the role of clinical symptom? For example, if I see the you know the connection, the compression or the you know the abnormality between the nerve and the vascular structure, but the patient doesn't have any clinical symptom, can I, you know, conclude that can I make a diagnosis of neurovascular conflict?
No, if patient without symptom, I don't diagnose neurovascular conflict.
Okay, so the clinical symptom play, you know, the crucial role, right? We cannot make the diagnosis of neurovascular conflict without clinical symptom, right? Hello, Nga.
Yes.
Okay. Okay, so yeah, for summarize, I think that the neurovascular conflict is I think it is a clinical diagnosis. So that's the reason. You cannot make the neurovascular conflict without, you know, clinical symptom. Okay. So when you in clinical practice, when you do an MRI of neurovascular conflict, you have to know about the patient symptom, right? Whether it is on the left side, on the right side, is the symptom of the facial nerve or of the trigeminal nerve. This is the first one, right? You have to know about the clinical symptom, and the second one is you should, you know, do you know an appropriate protocol, which must be you know comprise at least two slides, the CIS or the 3D steady state sequence, and the second one is a TOF, right? The TOF, beside two sequence, you have to do the other sequence, which rule out the other cause of the other cause of the other abnormalities the other, you know, intracranial abnormalities such as, you know, the flare, the DWI, or the tissue star. Okay, and and the third one is when you think that there is a neurovascular conflict, you have to detect the you know, the positive finding that we just mentioned, right? The bending, grooving, and the stretching of the nerve, right? Of the nerve, and the vessel must cross the root entry zone for the facial nerve is you know, around 3 to 5 millimeter, and for the trigeminal nerve is 4 millimeter, right? 4 millimeter. Okay, and when you don't see the nerve, the neurovascular conflict, you should, you know, pay attention on the other the abnormality of the nerve, for example, the neuritis, or the schwannoma, for example. It can, you know, make the it can be the cause of the clinical symptom. And you know that on the, you know, on the 3D imaging, on the 3D machine in our department, we can do the fusion between the top and the cyst, right? We can fuse between the top and the cyst to on the same on one sequence, so we can, you know, it is more easier to detect the conflict between the nerve and the vascular structure. Okay, have you ever do that before? Have you ever done that before, Nga? Do the fusion between the top and the cyst?
Yes.
Yeah. And do you have the case which show the neurovascular conflict on you know, on the fusion image? Yeah. Do you have a clinical case which show the neurovascular on a
case, but 2 case elo download today.
Okay.
So we ask the technician to make the sequence that fuse with these
Right.
2 sequences.
Yeah.
Oh.
You can yourself, or the technician can do it for you. The fusion, it's very simple when you do it on 3D. You can ask the technician do the fusion for you, and then he send to the back. He send to the back, and then or you can do it yourself at the workstation. And it would be better if you do it at the workstation. You can, you know, you can have a vision on 3D on 3D.
Okay, thank you.
But a case of fusion imaging. Hello, Tuấn. Do you have a case? Do you have a case to show it?
No.
No. Yes or no?
No.
Okay. So, do you have any question for this talk? So thank you, Nga, for interesting presentation. See you guys tomorrow.
Thank you.
Q resin Dr. Nga.